She reaches for the emergency button. Claudia Harder can't take it anymore.
I thought I was going crazy from the pain.
Claudia Harder from Kleinkönigsförde is a teacher and often catches something during the cold season. In October 2021, it is particularly bad.
Are you feeling
Yes.
unwell?
I can see that. I haven't seen you outside for a long time. Fever, cough, runny nose. But that was seasonal due to the daycare, which we always have sometimes. And I wasn't really worried about it because it was just like that.
But this time, it does not get better. Claudia Harder's son and his girlfriend live right next door, and her future daughter-in-law is a medical assistant at a general practitioner's office.
Then she came to me and said, "Gina, look at my joints. They are so swollen." And I looked at them and saw that they are really swollen.
She is alarmed and advises Claudia Harder to come to the practice the very next day. The family doctor takes a lot of time in the first conversation.
First, we should wait for the blood test results. She mainly presented with persistent fever, increasing fatigue, shortness of breath, and growing joint pain. I relatively quickly decided that we needed to do a laboratory examination.
Her suspicion is arthritis, an inflammatory joint disease. That could explain the problems. The lab results are expected to provide clarity in a few days. Meanwhile, Claudia Harder's unsteady movements are noticeable.
Her gait was already a bit restricted. I noticed she didn't move as easily through the garden or across the yard, but rather walked a bit more hesitantly, you know.
Takes care of it in her free time. She enjoys taking care of her chickens. Now she can barely manage it. Even feeding them is difficult for her.
It was already difficult and painful enough. And yet, there was still an increase in the symptoms.
Then, the blood test results are available. What stands out most is the high inflammation value. Nevertheless, for the doctor, it does not seem like arthritis.
She did not have the classic rheumatic factors in the lab tests, but there are also rheumatoid diseases that occur without the presence of rheumatic factors.
The family doctor advises Claudia Harder to get examined in a specialized rheumatology clinic. But before that happens, she is hit by a new shock. Her feet are extremely swollen.
I can't fit into my shoes anymore. And look here. It came out of nowhere, feeling very weak, being sick. And then it actually escalated at night with excruciating pain. And I was incredibly puzzled by this intensity and power.
Suddenly everything hurt and the hands were all swollen and all the limbs, and then nothing worked anymore.
The very next morning, she goes back to the family doctor. Swantje Zitron is shocked at how quickly Claudia Harder is deteriorating. What is causing these pains and swellings?
The alarm bells rang relatively quickly because she presented the overall picture of what I consider a rheumatological disease. And that's why this stooped gait there, the pain.
Despite the lab results, it all looks like a rheumatic disease. And then Claudia Harder shows the doctor her legs and the massive skin changes.
This shading on the legs, the marbling, the skin looked different. That really scared me.
The vessel patterns on the thighs, inner sides, but also a bit on the lower legs, on the knees.
Swollen joints, fatigue, dramatic skin signs. A rheumatologist needs to look at that as soon as possible. Medical assistant Gina Schulze already suspects what she will be busy with in the next hours. Repeated calls to rheumatologists, always the same answer.
We have a stop on new admissions, and I've kept trying from work, no matter where it didn't work. Also by fax, no one responded.
Your boss used to work at the University Hospital Schleswig-Holstein. Maybe there is an appointment slot available there in the rheumatology clinic.
But thank you, have a nice day. Bye. That didn't work at all, unfortunately. I then
Sent multiple faxes there with personal letters, also with these drastic lab results, with the rapidly worsening condition of the patient because she was already headed towards immobility. She could hardly stand on her feet anymore.
The doctor, Claudia Harder, now prescribes cortisone for the swelling and pain. Normally this leads to weight gain, but her family notices that Claudia Harder's sweater has become rather loose instead of tight.
Yes, I really noticed later that the pants got really baggy. I was like, oh, Mom, right? And that got me thinking, you don't usually know it like that, do you?
So that theoretically another illness could have been considered from the malignant category.
A cancer diagnosis? Fortunately, additional blood. No indications of temptations. Claudia Harder still can't get an appointment with a rheumatologist. Therefore, her general practitioner refers her to a regional clinic. Maybe the internists here will find an explanation.
We thought she would be admitted because she was feeling so bad.
I was marked by pain. Nothing really worked anymore.
Here, too, the doctors first take a blood sample from her. Then she is asked to wait in a waiting room. Surely the further examinations will start soon. But things turn out differently than expected.
Then this assistant doctor came and told me, Mrs. Harder, you don't need to stay here. We not only suspect, but we are now treating you with antibiotics due to Lyme disease.
In fact, she was years ago bitten by a tick and could have been infected with Borrelia. But hasn't that happened too long ago?
Borrelia can remain in the body for a lifetime and can be reactivated by various triggers.
Could that have happened to her? Claudia Harder is supposed to take antibiotics for 3 weeks now, but nothing gets better. Quite the opposite. She gets a high fever. The joint pain makes walking a torment. She can barely stand up.
I got out of bed and really couldn't walk anymore. I wanted to go to the bathroom and it didn't work anymore. So, complete loss of body control.
An appointment with a rheumatologist is still not in sight. Therefore, Claudia Harder now receives a referral with an urgency code.
Air rescue.
This should allow her to get a consultation appointment in an emergency clinic more quickly.
And then she got an appointment with a local rheumatologist, fortunately.
A consultation appointment with Frank Mosig. He heads the Rheumatology Center in Neumünster, Schleswig-Holstein Central, and listens very attentively.
I realized from the start, yes, this is the right place for me. This is exactly where I belong.
It seems to her as if the expert already has a suspicion. She would love to stay right here. Unfortunately, Frank Mosig can only advise her.
Then he explained to me why I couldn't stay with him, but he could establish contact.
Frank Mosig becomes active immediately. He knows a rheumatologist at the Ostsee Clinic Damp who, like him, has experience with rare diseases.
He called me and said he had a patient who was really sick and needed to quickly. She came quickly, and I believe she was admitted to us the next day.
Joachim Georgi sees in her reports, above all, that Claudia Harder's inflammation values are alarmingly high.
She had lost 8 kilograms and her skin was sallow, her joints were swollen, the lab results showed maximum inflammatory changes. So there was a serious illness in this woman. You could see it in her.
That she suddenly had such severe pain that nothing was the same as before, and she sat there like a little heap of misery in our bed and didn't know what to do and urgently needed help.
First, Annika Anker and Joachim Georgi must rule out other diseases. They find no indications of a tumor or serious infections. Next, The heart urgently needs to be checked. Patients with rheumatic, neurological and cardiological complaints are prone to inflammations in the walls of the blood vessels. Complications up to heart attack and stroke are at risk.
The inflammation levels and the overall presentation of the disease was so dramatic that one must also examine or rule out myocarditis, pericarditis, and as far as possible endocarditis.
Under anesthesia, the doctors examine the pericardium and heart valves with a special ultrasound through the esophagus. Even during the procedure, it is evident. The heart looks healthy, no inflammations can be detected. Now the medical team reviews all the symptoms once more. Swollen joints, pain, increasing weakness in movement, nighttime fever. What particularly stands out to them are the skin changes, not only on the legs.
The skin was somewhat salmon-colored on the décolletage, on the upper arms. There, in particular, she had these salmon-colored changes, which did not itch and had no scratching effects.
These particular skin changes could be a result of inflammatory processes and typical for a rare autoimmune disease. If the suspicion is correct, other organs would also need to show signs, especially in the upper abdomen. The rheumatologists check this with ultrasound. Indeed, they discover the typical changes.
Paste, enlarged liver, enlarged spleen, slightly elevated liver enzymes. So the situation gradually became a bit clearer day by day.
So another indication for the suspicion would be an increase in white blood cells in the blood. However, Claudia Hader regularly takes cortisone for the pain, and this skews the blood values, making a quick review impossible.
Then the moment actually came when Dr. Georgi said, "Mrs. Hader, we will now reduce the cortisone." And I already knew, no, please don't.
And really, the pain is almost unbearable afterward. But it takes a few days before the cortisone can be used again. Then the lab reports back. The number of leukocytes is dramatically increased, around 15,000. And another value is strikingly high, the ferritin level. He is the final missing piece of the puzzle, discovered by the youngest doctor on the team.
It was our youngest colleague, Ms. Eiben, who said, "Did you see this high ferritin, boss?"
The joint pain, the fever.
The exclusion of other causes and white blood cells. So everything just fits in her case.
To protect against invaders, the body forms tailor-made antibodies. They patrol through the organism, searching for invaders, attacking and destroying them. The immune defense also includes the defense cells of the innate immune system, and it is precisely those that have spiraled out of control in Claudia Hader, possibly as a reaction to an infection.
A switch is flipped in the immune system, and the body's own inflammatory cells spread through the body, starting to shoot their cytokines, their messenger substances at the organs, the joints, the skin, the internal organs, and they just don't stop.
These cytokines, shown in green here, stimulate the immune cells, and those in turn attack the body itself. Still's disease, the name of this extremely rare illness.
The frequency is roughly 1 in a million, but they exist. And Mrs. Hader was one of them.
I have a diagnosis and now they know how to treat it. That was so important.
In addition to the cortisone, she now also receives biologics that help block the inflammatory messengers. Gradually, the swelling and pain reduce. Physiotherapy helps to regain mobility and fitness.
That is my big goal, to become more consistent there. And I already achieve quite a lot, I think.
Above all, confidence and joy of life have returned to the family's farm. mind, Claudia Harder can feed her beloved chickens daily again.